Hello, this is Dr. Gay from First Second MRI, and this is a 50-year-old female who complains of foot and ankle swelling and pain. She has had no prior history of injury, and she has some striking findings here. So this is a sagittal view. We can see the patient's tibia coming down here to the ankle joint. This is the patient's talus. This round area is the talar dome, and we see that this is too wide, the joint here. We also note that there's abnormal signal. This bone should be really bright, but instead it's dark. So this patient has marrow edema all throughout the bones of the hind foot and into the midfoot here. So lots of marrow edema, and again, abnormal position of this bone, the talus, this widening here. If we look on this, we see the problem. This is a coronal view looking straight down the barrel, and we see that the talus here is angled medially. This is the talar head, and it does not articulate with the bones. Normally this will articulate with the navicular bone. The navicular bone, though, is way over here, so this is a dislocated talus. And it doesn't articulate right here in this cup. It's just over here by itself, so it's dislocated medially, and also there's widening here in the lateral ankle joint, so this is rotated medially as well. Also, this is low in position, the talus, since it's dislocated and rotated, and because of that low position, we see the calcaneus on the sagittal view. This is the back of the calcaneus, the back of the heel, and this area here normally is far below the ankle joint, or a little bit below the ankle joint at least, but here the ankle joint, and this is above. So this is abnormal high position. It's related to this talus dropping down, being dislocated. We also see marrow edema again throughout these bones. This is the anterior calcaneus. The patient also has a ruptured tendon up here. This is the patient's posterior tibial tendon coming down along the medial side, and it ends right here. Normally this will come down, loop around, and attach way down here on the navicular bone. So this is ruptured and retracted way up here, and the remaining tendons are intact. This is the patient's plantar fascia. It's partially torn and attenuated here where it attaches to the calcaneus. So lots of findings, but the main finding really is this dislocated, rotated navicular bone and lots of marrow edema throughout here. So when we see findings this striking and the patient has really no clinical symptoms, it's almost always Charcot foot, which is diabetic neuropathy. The patients typically have chronic diabetes, and they have neuropathic findings related to lack of pain sensation, and they will not feel any problems in their foot, and that leads to joint destruction, bone fragmentation, dislocation, just like this. And the fact that she doesn't complain much in the way of symptoms is a classic clinical history to go along with really striking findings. Now, one other thing, which is osteomyelitis, could cause this. If the patient has bone infection, it can cause bone fragmentation, destruction, but usually the patient would have some more striking clinical symptoms, we think. This is all soft tissue swelling here medially. So a really complex case here of probable Charcot foot, which is diabetic neuropathy, with a dislocation of the talus and abnormal position of these bones here. And thank you very much.